want you all to imagine that you're a heart attack patient straight out of surgery. A nurse comes into your hospital room to bring you your dinner and brings you a tray of food that looks like this. Now to me, that doesn't look like a very heart-healthy meal. But unfortunately, meals that look just like that are often what is served to hospitalized patients, and this leads to the development of malnourishment in these patients. In order to better explain this issue, I'm going to tell you about what malnutrition is, its effects on hospitalized patients, and then I'm going to point out some of the causes and possible solutions to this problem. Now, as both a pre-med and nutrition student, this is an issue I've thought a lot about, and it is an area of medicine I've considered working in the future. I would also like to point out that it is likely that most of you or a loved one of yours will be hospitalized within your lifetime, so it's important to be educated about this issue so that you can advocate for yourself and others. Now, the first step in educating yourself about this issue is understanding what malnutrition is. Malnutrition is the lack of proper nutrition resulting from not eating enough or not eating enough of the right things. It is a massively under-recognized problem in hospitals that has severe negative impacts on hospitalized patients. In a study published by the International Medical Journal for Experimental and Clinical Research, analyzed by Dr. Kontrak and colleagues in an article titled Malnutrition in Hospitals, it is revealed that 44.6% of hospitalized patients develop malnutrition across the course of their hospital stay, after receiving a mere 759.9 calories per day on average. Now, if you look at this picture, 759 calories is a lot less than the 2,000 calories an average adult should be consuming per day. The malnourished patients were also revealed to have lower blood oxygen levels, lower heart rates, and lower respiration rates, as well as increased levels of inflammation. These measurable health changes are what are known as clinical outcomes, and they are what doctors and facilities use to test the effectiveness of their medical treatments. Now, these overall negative clinical outcomes for malnourished patients shows that failure to receive the lack of proper nutrients results in decreased success of medical treatment. Other research shows that malnourished patients on average serve longer hospital stays and have higher rates of readmission, meaning it takes them longer to heal and there's higher chances of them having recurring problems which result in rehospitalizations. Now, clearly this is a severe issue, but in order to address it, we need to understand its causes. The biggest cause of this problem is that there is a lack of nutritionally trained professionals in hospitals. Doctors, unfortunately, receive very little nutritional training, and although most kitchen staff do have nutritional backgrounds, they are not trained in the specific needs of each department. In an article titled Improved Meal Service, written by doctors Yona, Goldsmith, and Endelvelt in 2020, published by the Israel Journal of Public Health Policy Research, it was explained that each department of a hospital treats many different complex illnesses and therefore have specific nutrient needs. On a more individual level, factors such as age, mental health, and prior medical history can put individuals at higher risk for developing malnutrition, and if hospital staff are not aware of these risks, then they can promote malnutrition accidentally in individuals that would otherwise be properly nourished. A third cause of this problem is that the consumption of food that is given to patients is not monitored. Nurses drop off trays, they pick them up, but they don't track whether the patients have actually consumed the food they are given. Now, on the upside, because this is a problem with identifiable causes, it also has some identifiable solutions. In the aforementioned article, Improved Meal Service, a study is documented across 3 years that tests the impact of adding a food service dietitian to hospital staff. In the hospitals where this rule was added, full nutritional analysis was done of each menu item, and this resulted in the development of specialized nutrition plans for each department. The food service dietitian served as a communicational bridge between medical staff and kitchen staff, allowing both groups to come together to create successful nutritional therapies. A registered dietitian can also serve as a communication bridge between medical staff and patients to help explain to the patients the importance of the nutrition care they are receiving. In a 2018 Journal of Academy of Nutrition and Dietetics article entitled Creating a Great Patient Experience, written by registered dietitians Rollins and Novak, it was explained that when patients better understand doctors' orders, they're more likely to follow them, which leads to more successful patient outcomes and lower readmission rates. A secondary and equally important solution to this problem is implementing preliminary nutrition screening. In a 2019 Healthcare Business and Technology article titled Nutrition Plays a Big Role in Patient Outcomes, written by Jess White, the benefits of adding preliminary nutritional screening were tested. 4 Chicago hospitals added an advanced care option to their nutrition programs. They then completed nutritional screenings on every patient admitted to the hospital, and those deemed at higher risk for developing malnutrition received the advanced care program. This study showed that preliminary nutritional screening increases the effectiveness of nutritional therapies, as the average length of stay for these patients decreased by 25%, and the average readmission rate decreased 27%. Now, these solutions could very well help solve this problem, but they require motivated and educated individuals that are involved in the system to spur forward the change. Malnutrition is a severe problem in hospitals that decreases the success of medical treatments and can cause long-term complications. It is caused by an overall ignorance of the importance of nutrition in hospitals and by putting the wrong people in charge. Implementing preliminary nutritional screening and adding more nutritional staff to hospitals will reduce the rates of malnutrition in hospitals by targeting nutrition at the content, delivery, and consumption levels. And hopefully that same heart attack patient would receive a meal that looks more like this. Thank you. 10,000 degrees in here. My God.
All right, Roger, how did that go for you?